Okay, so I'm here with Dr. Elizabeth Pena, who was my mentor and advisor in my doctoral program. And we've been having a conversation about testing and with COVID-19 and the possibility of it continuing through summer into the fall. We really don't know at this point how long this is going to go on. But one of the big topics in our field has been assessment. How do we do assessments in a remote way? People are kind of panicked about it. What I'm hearing from school districts all over is we're just going to put all of the evaluations on hold. So I'd love to hear your thoughts on that.
I don't think that we can put testing on hold because we owe it to kids that we're serving to identify them in a timely way and to provide services to them in a timely way, especially kids who, kids from bilingual backgrounds especially are often underserved, and testing gets delayed as it is because a lot of times the assumption is that, well, they don't know English yet, or they're delayed because they have exposure to two languages. So we already see delays in that population. I don't think we can delay anymore. And so I think that there's some urgency there in terms of making sure that that doesn't happen especially for this group of kids. And I know that that's the group of kids that you work with, right? So
Right.
I also wanted to say, we'll back up, that, you were my first doctoral students, and in a lot of ways we grew up together, right? Academically. So
Yep, we're still figuring it out.
Yeah, there's that. Yeah, when you said that, I'm like, yeah, and so you also maintain ties, to your you always maintain ties to your students, but you were my first, and I think you were, closer in age, closer in, in collaborating and, doing, working on stuff together. But anyway, going back to the other issue, I think that, yeah, you guys especially are working with kids who are bilingual, and they're notoriously have delayed identification. So I think that's going to be really critical here.
So on that note, let me ask this question. So one of the concerns is tests were not normed in a remote format. So what are your thoughts on the psychometric properties of the test and what happens to them when we shift formats like that?
I think that we have to focus on what are the tests trying to do, right? And so what we're trying to do as speech language pathologists is to identify language impairment or speech impairments in a way that's pretty authentic, whatever that means. And we're trying to understand how children have breakdowns in their communication. Now, can we do that remotely? I don't see why not. There's a review paper that reviewed about 100 studies looking at teletherapy. Some handful of them are on assessment. So there's generally some consensus that it can be reliable doing it remotely, and we have to think of the same things that we would think about when we're doing any other kind of testing. So is the child engaged? Are they paying attention to the pictures that are displayed on the screen? Are they getting additional prompts that they shouldn't be getting? So I think those are all the kinds of things that we need to pay attention to. In the aphasia literature, I know that Stephanie Grosso and Maya Henry and some of those folks have been looking at reliability of intervention done through teletherapy, and it seems to show similar effects. So that's something that's promising. If you think about our assessment practices and what we're trying to get from kids, I don't think that it would be less reliable, but I think we have to think about certain things, right? We need to make sure that the child is paying attention. I talked to Michael Smith earlier this week. So Michael talked to us about making sure kids are paying attention. So he does some, just checking, like touch your nose, or tell me your name, and, those kinds of introductory things. The other thing that they do is they make sure that the kids, if at all possible, are wearing headphones. That increases attention and it minimizes how much other people may be able to hear what's going on.
Yeah.
Right? And so then you won't have parents necessarily in there prompting children, which is what you don't want when you do testing.
Right.
You know, in a lot of the tests that we do some practice tests, right? Some practice items.
Mhm.
And so maybe it would be worth doing extra practice items or repeating the practice items to make sure that the child is understanding and make sure that the family, that the older sibling or a family member isn't prompting inappropriately and that kind of thing, right?
Right.
And you could do some like a mini training that way to make sure that you have that reliability. So I think those kinds of things will help us to increase fidelity
Mhm.
in test administration.
Yeah.
Um,
I would say too that that's very, I mean, it's really not that different than when we're sitting with a family member in the room and we say,
yeah.
I know that you know this and we need to not give prompts, sit on your hands if you have to. But I think those are some
Mhm.
of the same issues. I would also say that, in any test administration, there's error. And we have to think about that. And we will have it
Mhm.
remotely, we have it in person, but we deal with that by using our clinical judgment, by doing some informal tasks, by
Mhm.
doing some dynamic assessment. And those are all things I think we can incorporate into a remote platform in the same way that
Exactly.
we in person. So,
Exactly, exactly. And we can you know, we still can interview parents. We can still, you know, try to understand the communication environment, and all those pieces go into a diagnostic decision. So it's not simply about standardized tests.
right.
Exactly. Yeah.
Right.
Yeah.
And
So
even if we chose not to use scores, if we felt like the administration was such that we couldn't use the scores, we still have great qualitative information that we can pull out of the administration of a test. So I think
exactly.
people are in a little bit of a panic about the scores, but I don't think we need
Mhm.
to be. I really don't think it's any different than what we do every day, every time we give.
Mhm. I think that we're talking about communication, and we should be able to, you know, be creative and get good information from kids, from families about kids' communication abilities.
Yes, I totally agree with that. That, this is something we're going to have to figure out how to do because we can't just stop evaluating kids. Communication disorders don't go away, unfortunately.
Yeah.
So,
Yeah. Yeah, and again, I think it's an opportunity, right? So if we can figure this out, then what does that mean for testing in the future? I mean, this also gives us the opportunity to test remotely families that are hard to get to, or families who have, you know, difficult schedules, or you know, kids who are at home medical reasons or whatever. So I think that we have some opportunities to really expand and refine our practices,
mhm.
you know, in this.
Yeah, I agree. I agree. Thank you so much for doing this today. I appreciate it. I'm going to
Yeah, no problem.